The Africa region is one of the regions with the highest burden of chronic hepatitis B virus infections. Globally, there are about 296 million people living with chronic hepatitis B, and the Africa region has about 80 million, which is really high compared to the other regions. The prevalence, the proportion of people with viral hepatitis B infection in Africa is highest compared globally. We have about 7.5% of people living in Africa living with chronic hepatitis B compared to a global average of about 3.5%. The statistics are worse in children, because in children we have about 6 million children under 5 years of age living with chronic hepatitis B, and the majority of these are actually in Africa. We have about 4 million. So 2 out of 3 children with chronic hepatitis B are living in Africa. It's also concerning because children in Africa, there are goals that the World Health Organization that has set to eliminate viral hepatitis B. And one of the goals is to have a prevalence of less than 1% by the year 2020 and less than 0.1% by the year 2030. The 2020 target was not achieved in Africa. That's the only region in the whole world that did not reach that particular target. While the global average was less than 1%, in Africa we had 2.53% of babies or children under 5 years of age living with chronic hepatitis B, which is really unfortunate. One of the reasons that I'll give as why we do have a disproportionately high burden in Africa for viral hepatitis B is lack of awareness about the disease. Unfortunately for hepatitis B, it's what is considered as a silent infection, whereby you get the infection today and you don't have major symptoms manifesting until much later in life, when you're old, maybe in your 30s or 40s or 50s. That's when you start developing complications associated with that. So that lack of awareness makes cases of viral hepatitis go undetected. I remember when I was training as a medical doctor, whereby in the training hospitals that I was attending, there were quite a number of patients who would come with liver cancer. And the good thing is that within the referral facilities, we could test and get to know that they had viral hepatitis B. But the centers that were referring this case to this tertiary hospital were did not have the capacity to test. So you can imagine, even in those particular centers where they are closer to the people, do not know that they're dealing with viral hepatitis B, and they cannot be able to even put in measures to control that, because they really do not know about that. So lack of awareness is one of the major challenges when it comes to addressing this. And unfortunately, we have a lot of work going on in other countries which are resource endowed in terms of having testing facilities available, even in very remote or rather in low levels of care. Unfortunately for Africa, especially for those settings where they do not have advanced capabilities or resources, they have cases that they do manage, but they're not able to diagnose them as viral hepatitis B, and therefore cannot appreciate the burden associated with that disease. Viral hepatitis B causes great inequities in Africa. Like the fact that the complications occur much later in life, especially around the 3rd or 4th decade of life. And that is really the prime of the most productive age. That's when most of the people get these complications, including liver failure and including liver cancer. And these diseases are very hard to manage. They call for a lot of resources to be able to treat those advanced, and the treatment is often not very good because you have poor outcomes of these diseases. So you can imagine the amount of resources that go into managing these complicated cases if they are available. And of course, most settings, especially the resource poor settings, these resources are not available. We are also talking about parents of children who are dying at that age or getting sick at that age when their loved ones are most in need of them. You know, they have young children who need to be fed, and because of these infections starting to complicate at that stage in life, it denies them this opportunity for them to be able to take care of their immediate family members. So viral hepatitis also diverts resources that could have been used for other economic activities towards treating some of these complications. And the unfortunate thing is that most of the cases that even require that those resources do not end up well. And therefore prevention really is the most important aspect when it comes to managing viral hepatitis B. To help countries address the problems associated with viral hepatitis, the Coalition for Global Hepatitis Elimination has been very instrumental in working in African countries to promote the hepatitis B birth dose vaccine. We have been working very closely with civil society organizations to be able to develop important and clear messaging that can be able to inform the population about the vaccine, the importance of having the vaccine at birth to prevent mother-to-child transmission, the importance of having the vaccine, because once you start having the vaccine and complete the vaccination series, then you get protected from viral hepatitis B for the rest of your life once you complete the vaccination series during the infancy period. And therefore, the Coalition of Global Hepatitis Elimination has been working with these civil societies organizations to be able to promote and to advocate for birth dose introduction. We have had some very good success stories with these, because we have talked to governments. Uganda Ministry of Health has recently introduced the birth dose vaccine, because the civil society organizations working in Uganda have been able to pass this message along to policymakers, explaining to them the importance of having this particular vaccine. We also have other countries that are already in the process of developing policies to support birth dose introduction, and we are very happy that these conversations are now happening, and it's through this knowledge and raising awareness that we'll be addressing some of these inequities that are associated with viral hepatitis B infection. Another area that we need to focus on when you're talking about intervening for viral hepatitis B in Africa is about having more resources towards understanding or even developing treatment for viral hepatitis B. The current treatments that are available for viral hepatitis B are very useful because they prevent the complications from developing. Unfortunately, they are not curative. A lot of resources has been committed towards viral hepatitis C, and we are happy that we already have treatment for that. Unfortunately, for viral hepatitis B, which is more common in Africa, we do not have therapeutics that are curative. We need more investments on that area, and I call upon pharmaceuticals to start thinking about developing some of these particular products. More importantly, too, is to also start thinking about how do we make sure that the population that is hard to reach in most African countries can access even the available therapeutics that are there. You know, how can we make sure that we are able to do that? And I think we need more research to be able to inform some of these implementation needs to reach these particular populations. I think more importantly, we need to make sure that you also have a forum where researchers can be able to share knowledge and can be able to inform new research priorities that can be able to be addressed by creating this forum where African researchers can be able to be empowered to be able to share what they have experienced down on the ground, and can be able to start thinking about innovative ways of making sure some of these therapeutics and even other testing strategies, including monitoring and especially when it comes to treatment, how best can we utilize whatever resources that is available to reach those hard to reach, to break down the inequalities associated with these infections.